Healthcare in India has another name, Ashwini Hospitals. When one talks of getting the right kind of treatment, the Ashwini Group of Hospitals stands tall in its commitment to providing state-of-the-art medical care to the community. Based in Odisha, the group has become one of the most trusted hospitals in India's healthcare sector. The Ashwini Group of Hospitals was founded in 2006 by its Dr. Subrat Kumar Jaina and Dr. Maya Guntayat, marking the beginning of its journey to serve the healthcare needs of the people in Odisha and the surrounding regions.
Yeah, Ashwini Group of Hospitals initially started as a higher specialty referral center with 100 beds in the year 2006 at CDA Kotak. Then we went on to add more beds. So presently the main hospital has 200 beds, and the trauma cases are now treated exclusively at another 200 bedded hospital called Ashwini Trauma Centre, which also has 200 beds. Then we also have Aditya Ashwini Hospital in Bhubaneswar with 100 beds.
Ashwini Hospital is a super specialty hospital. Myself, I am a neurologist and trained in NIMHANS, and after training in NIMHANS, I have come to Odisha to start my work. We are sort of very much into getting all the modern equipments available at various times. We've been having these equipments. So if I have to be more precise and tell you what we have right now, is for neurology, we have of course the entire gamut. We have MRI scan, we have a multi-slice 500 slice CT scan, then we have the neurophysiology lab, which is quite modern, and for neurosurgery we have operating microscopes, which is very standard, and we have a neuronavigation system. We have CUSA, which is used for tumor surgery, and of course we have a dedicated intervention lab where we do neuro interventions like advanced endovascular techniques for aneurysm coiling, for carotid stenting, and doing routine digital subtraction angiogram for vascular pathologies. In critical care, we have 50 bed critical care, and we cater to a lot of serious patients. So we need to have a fully equipped critical care department, which we have, including the doctors who are qualified, and for the rest of the departments, cardiology, of course, you know, we need to have a cath lab for interventions, which is going on regularly since 2009. It's almost 15 years. We are doing regular cardiac cases.
Some of the Ashwini Group of Hospitals' key specializations include neurology, orthopedics, plastic surgery, respiratory medicine, emergency medicine, and nephrology. Over the years, they have expanded their expertise in response to the evolving health needs of the nation.
My name is Dr. Sampat Das. I work as a senior consultant in the Department of Respiratory Medicine at Ashwini Hospital Cuttack. After COVID, we do understand that respiratory is actually an area of concern and need more activities and more research in those. What we are finding these days is that because of the increase in the age of the population, because of the pollution, the work culture change, we are finding a huge number of cases of COPD cases who are obstructive airway disease. Obviously, our department is constantly working to improve the quality of the care. What we are focusing more is that, first of all, more advanced diagnostics tests, especially what I have talked about is the COPD and other things, where we need advanced tests like DLCO, FENO, 6-minute walk test, F40. All these things are as of now available in our center, and we are doing it regularly on the patients to diagnose whether they are suffering from this disease in a very early part. We are also working on the sleep medicine part, because that's also an area which people are not aware of. And apart from all these things which we are talking about, we also have the high-end radiological unit associated with us, where we find out, we do all the type of virtual bronchoscopy, CT scan, and find out the lung disease quite early, which was difficult in the previous days.
India has a rising burden of neurological disorders. A staggering 1 crore people in India suffer from epilepsy. To attend a rapidly increasing need for neurological treatments, Ashwini Hospital has a well-established department of neurology. headed by the co-founder and managing director of the Ashwini Group of Hospitals, Dr. Maya Guntayat.
In neurology, we have acute neurology and we have chronic neurology. For acute neurology, we have for stroke or for acute GB syndromes or acute myasthenia gravis coming in respiratory failure, or epilepsies who have got refractory epilepsy not being controlled with medication. We have a good setup to treat all these patients. Like for example, we have myasthenia gravis. These patients may come with acute respiratory failure. Then not only we have to put them on ventilator and treat them with in the intensive care unit, we have to give them plasmapheresis, we have to give them IVIG. So all these facilities are available for acute respiratory failure due to neurological diseases. Then for epilepsy patients, when we think of doing epilepsy surgery, then we have our MRI scan machine, which has got a functional MRI attached to it and a neurocont, all put together. We can identify and we can tell which patients would benefit for which kind of epilepsy surgery, so that epilepsy which is refractory can be treated. In the neurosurgery department, we do have a CUSA, which is an ultrasonic aspiration cutting, where you don't do, the tumor is not cut through, but through just ultrasonic device, you can remove the tumor. So very difficult tumors in difficult locations, it can be done very successfully. So all these facilities are available in this in our hospital.
Ashwini Hospitals in Cuttack is renowned for its exceptional and comprehensive general surgery services, catering to a diverse range of medical conditions and surgical needs.
This Ashwini Hospital caters the orthopedics, the neurosurgery, general surgery, plastic surgery, and all the traumas. So mainly the advancement is mainly in the general surgery part. If I talk, I do all the laparoscopes, and apart from the open surgeries, I do all laparoscope. And we are going to introduce a laser proctology, so that the patient gets well soon and the stay in the hospital is very minimal.
The Ashwini Trauma Centre in Cuttack is a specialized medical facility dedicated to providing urgent and critical care to patients who have sustained traumatic injuries. Equipped with state-of-the-art technology and staffed by a team of highly trained trauma surgeons, emergency physicians, nurses, and support staff, the centre ensures swift and effective medical attention to individuals in their time of need.
When we started with a lot of stress on critically ill patients who probably were not getting enough treatment because the infrastructure at the nearest hospital or the only kind of a medical college hospital here in this area did not have adequate critical care facilities. So we started with these critical care facilities, which has grown over years. From 8 beds initially, now it is about 80 beds. And we are able to take care of certain things which pose a real problem in treatment and management of patients. That is multiple coexisting diseases. Which a patient can have an accident, but that doesn't prevent him from having a cardiac illness in the background, or a nephrological renal failure, or a neurological illness. So therefore, we are probably, I would consider that Ashwini Group of Hospital is best at taking care of these patients who have multiple coexisting problems. I think that is where we score the best.
I am Dr. V.K. Reddy, consultant orthopedic surgeon. I am the head of the Department of Orthopedics and the senior faculty in the DNB curriculum. And I am also the medical superintendent of this Ashwini Trauma Centre. It is a referral center for the government of Odisha, and we are getting a lot of trauma patients from the different hospitals across the Odisha also. So basically we are dealing with a lot of trauma patients and polytrauma patients with lot of crush injuries. Along with this, we are doing the finger reimplantation, major limb reimplantation, and all sorts of free flaps, microvascular surgery.
ମୋ ନାଁ ସୁଶାନ୍ତ ବେହେରା ମୁଁ ଅନୁଗୁଳରୁ ଆସିଛି ମୁଁ 2015 ମସିହାରେ ସର୍ବପ୍ରଥମେ ଅଶ୍ୱିନୀ ହସ୍ପିଟାଲ ଆସିଥିଲି ସେତେବେଳକୁ ମୋ ଗୋଡ଼ ବି ଚଳୁନଥିଲା କିନ୍ତୁ ସେଟା ଭଲ ହେଇଗଲା ପରେ 2022 ମସିହାରେ ପୁଣି ସେକେଣ୍ଡ ବାର ବି ସେ ପ୍ରୋବ୍ଲେମ୍ କି କ'ଣ ହେଲା ସେ ପୁଣି ଆସିଲା ବେଳକୁ ମୋ ଗୋଡ଼ ଦୁଇଟି ଚଳୁନଥିଲା କିନ୍ତୁ ମୁଁ ମାୟା ଗନ୍ଧାଙ୍କ ସାର୍ଙ୍କ ଟ୍ରିଟମେଣ୍ଟ ପରେ ମୁଁ ତାଙ୍କ ଔଷଧ ଖାଇ ସମ୍ପୂର୍ଣ୍ଣ ଆରୋଗ୍ୟ ହୋଇ 2 ମାସ 3 ମାସ ବେଳକୁ ଚାଲିବା ଆରମ୍ଭ କଲି.
So as soon as we receive patients from emergency to the ICU unit, the first thing for us is to prioritize our treatment as regards how sick the patient is, and we receive patients from almost all walks of life. Our hospital being a primary neurology and neurotrauma center, we receive patients from neurology, neurotrauma, polytrauma, medicine patients, respiratory patients who are having very acute conditions due to drowning, poisoning, snake bites and all those things. So state of the art equipments available to us, yes, we are having stethoscopes, but slowly we are changing from stethoscopes to point of care ultrasound. So that is one thing we have emphasized on. Of course we have static monitors of monitoring, and of course we are using dynamic monitors, but the most important thing is liaising with all other departments, because we have almost every state of the art investigation that you can possibly imagine, and the key here is to do things as quickly as possible, because the quickly that you can do, the lesser you have to do.
The department houses a team of skilled and experienced plastic surgeons who are proficient in a wide range of procedures, including reconstructive surgeries for congenital deformities, trauma-induced injuries, cosmetic enhancements, and post-burn reconstructive surgeries. This department stands as a beacon of hope for individuals in need of reconstructive and burn care, emphasizing both aesthetic and functional restoration to facilitate patients' physical and emotional healing.
So let me talk about one particular child who had sustained a cross injury by a vehicle runover. That boy was about 6 or 7 years old, whose father is still working in Indian Army. The mother is a primary school teacher. So the vehicle ran over both the lower limbs, both the legs of the child. So by the time we received him, the child was very sick. So to save the life of the patient, we decided on amputating the limbs from wherever it was not viable. So ultimately the child landed up in losing both the lower limbs. It was a Herculean task. He was just a child, and the mother had lost hope, but we did not lose hope. We went on to do several reconstructive surgery procedures and ultimately provided this child with 2 artificial limbs below knee.
The Smile Train program at Ashwini Trauma Centre in Cuttack is a remarkable initiative dedicated to transforming the lives of children born with cleft lips and palates. The program, in collaboration with Smile Train, a global charity, aims to provide free cleft lip and palate surgeries to children in need. The specialized team at Ashwini Trauma Centre, comprising skilled surgeons and healthcare professionals, works diligently to assess, prepare, and conduct safe and successful surgeries for affected children.
We also do a lot of birth deformities. In birth deformities, you must have all seen cleft lips and palates. Every child in 500 live births is born with a birth deformity. It might come to you as a surprise. Whether it is in the face or the hand or the legs, they come with birth deformities. And these birth deformities do not form an indication for a medical termination of pregnancy, because these are largely correctable. So the children with cleft lip and palate, we have tied up with the world's largest NGO, Smile Train. If a child comes, is underweight, is undernourished, we provide them nutrition. If there are deformities in the teeth, then we take care of the dentition. If they are not able to speak well, we have a speech pathologist to help them in learning how to speak after the surgery. The whole idea is to let the child grow as a normal human.
तो आम पिलार ओठटा ऊपर उठी जाता पैलेट भी नाला से आसलु आमर शिवन मैडम ऑपरेशन करते 5 मास पर ऑपरेशन होता ओठटा आग कंप्लीट हो सारा तापर जाई 9 मास तालुका ऑपरेशन होता ओठ ऑपरेशन तालुका ऑपरेशन पर एबे स्पीच थेरापी चलची हाँ ये खाइबा सुविधा अच्छी सकाଳେ संध्याळे दीपर राति रे होची तो स्टाफ मान भी भल आमको साहाय्य करछन्ती पिलार ट्रीटमेंट रे।
Before the break, we showed you the wide array of treatments that the Ashwini group of institutions has to offer, from pulmonology to trauma to neurology. Of course, key to the success of any hospital is a world-class standard of hygiene. Cleanliness and sanitation at Ashwini group of hospitals are of paramount importance, reflecting the institution's dedication to maintaining a safe environment for both patients and staff.
You know, the hospital is a site where health is taken care of, but we also add hygiene before health. So we have regular tutorials in hand hygiene. So what happens is the same doctor or a healthcare provider touches 10 odd patients. So it is very easy to contaminate one person with the infections present in the other person. So therefore, before and after handling any patient, they need to sanitize themselves, the hands especially. So they have to put on a cap and mask to barrier cross infection.
At Ashwini Trauma Centre in Cuttack, aspiring doctors have access to a range of postgraduate courses that play a pivotal role in shaping their medical careers. The centre offers specialized PG programs designed to provide comprehensive training and education to doctors looking to deepen their expertise in trauma care, emergency medicine, surgery, and related fields.
So we are conducting cadaveric courses and symposiums. Through CME symposium and cadaveric courses, we are teaching them the latest advances courses.
With DNB course coming in, we are looking for the future pulmonologists to work with us to learn the basic fundamental aspect of pulmonology. Because pulmonary medicine previously was thought to be more or less an outdoor practice where we just used to see patients and dispose them with inhalers, but that is not so. We are training people not only on the outdoor practice but also on managing those who become critically ill, because 50% of our respiratory cases will require some form of ICU care in the course of the disease. So they must be aware that how to take care of these patients when they land up in ICU setup.
As a senior, I would like to say that this center, especially Ashwini Trauma Centre, which is an immense caseload, so this is a very good platform to learn. Not only learn on the surgical aspect part, because we also do a high caseload every day orthopedic surgeries, plastic surgery, but also in the terms of academics, this is a very good institute. All the consultants are very good in academics and they teach us in a very nice way.
For the past 17 years, the Ashwini group of hospitals has been standing tall as a highly trusted healthcare institution in Odisha, specializing in various medical fields and offering a substantial number of beds to cater to the healthcare needs of the community. It is no wonder that its commitment to quality healthcare and specialized services have earned the Ashwini Group of Hospitals a formidable reputation as a leading healthcare provider for all of India.